Hello everyone, how are you? Today we are going to discuss another question regarding MRCS based on eMRCS. Here the question: a 43 years old lady undergoes a life related renal transplant. At the conclusion of the operation, she has a good urine output and the graft appeared well perfused. On the ward, she suddenly became anuric. What is the most likely cause? Here you can see a 43 years old lady undergo life related renal transplant. At the conclusion of the operation or at the end of the operation, she has a good urine output and graft appear well perfused. So in this section we can see the operation was okay, operation was successful, but suddenly in the ward, that means within few hours of operation, patient become anuric. What is the most likely cause? So here, this point is very important that on the ward, that means it is within very short time, but not during operation. After operation in the ward, within the past few hours, she suddenly become anuric. So what is the most likely cause? Here the options are renal artery stenosis, renal vein thrombosis, renal artery thrombosis, hyperacute rejection, and acute rejection. Here we can see first option, renal artery stenosis. For the stenosis, usually longer time required. Usually it occurs after a repetitive inflammation or long standing hypertension, then a renal artery stenosis occur, but it occurs immediately, so renal artery stenosis will not be an option. Renal vein thrombosis: in the renal vein thrombosis, the urine output should be present, but the patient develop absence of the urine and she is anuric. Renal artery thrombosis, it may be another a option, because if renal artery obstruction occur, then no blood in the kidney, so no urine production is possible. Hyperacute rejection not possible, because in hyperacute rejection it occurs during the operation table. And acute rejection, usually rejection recurs sometime, and it starts gradually. So here we can see the renal artery stenosis typically occurs over several months. That means it requires a longer time, results in development hypertension, and that types of the patient they become hypertensive. Most cases can be assessed using duplex scanning and managed with angioplasty. So final answer is renal artery thrombosis, because it occurs after the operation but within the few hours, and other options are not compatible. Thank you.